Hi. All right. So I finished the 20 sexual problems and solutions. I know I've got more, but I decided to switch it up today. My sister asked me to talk about smells, and smells are a hot topic all the time, right? So I said, okay, I'll try and talk about it today and see what we get. Okay, so first of all, I want you all to know that it is very hard to find studies about whether men like us to have a smell or don't like us to have a smell. All right, so first of all, there's no studies. I've tried and looked and looked. All right, so we need some studies, y'all. We're going to do some studies, do some studies. We need some studies to find out what percentage of men love the smell and what percentage of men hate the smell. But as you can imagine, it varies across the board, right? So each man's going to have their own like and dislike in terms of smell and odor, okay? If you look at women, same thing, right? We are going to have some smells that we don't like and some smells that we do like, but most women are very picky and finicky, and a lot of men are too. But the key is that, first of all, you got to understand that yes, women can like those smells and men can like those smells, but it all depends on what the smell is, right? And how strong, etc. We'll talk about that in a second. But you really have to understand that we are wired different in terms of our smell. For example, physiology, right? We have different genetics, so we have different ways of smelling. Our olfactory bulbs, our olfactory process is very different for each of us, right? And a lot of it's based on our culture, how we were brought up, how we were cooked. They cooked for us, how we smelt things in the environment, foods, all sorts of stuff. So if we grow up and we're eating certain foods in different cultures across the world, we're going to have different olfactory smells, right? And if you grow up and you change your food, it'll change with the food changing too. So your smells can change over time. And it's important to know, because if you don't know, you'll be wondering what's going on in terms of you're smelling one person over the other, right? So yes, each person does smell different. Each woman, each man smells different. We have our unique smell, but we also change our smell over time depending on what we eat, etc. Okay? When you are smelling someone, so many things go into play here. So we're talking about not only vision, but taste. All that stuff goes on. So it's going to be unique. Evolutionary psychology also says that we tend to be attracted to certain smells, right? Pheromones for choosing our mate, right? There's some immune system relativity to that, so we've got to really make sure that we are aware that when we're smelling someone, the person that we're attracted to, I love talking about this, usually has the opposite immune system to us. So we are actually having an attraction because that immune system is completely different from ours, or mostly different from ours. So that when we have a child, we'll have a child that has a very strong immune system. So that smell is amazing. We don't realize it. It's just unconscious. We don't even know what's going on. But that mate, they did some studies years ago, and it showed that they actually have that knowledge somehow in our brains that they have the different immune system. But, again, when we are talking about the vaginal smell or the male genital smell, it's a little bit different. More studies are done on, the sense of smell and attraction, sexual attraction. But I'm talking now about the genital smell in terms of your partner and yourself. When you are having these smells, just remember that across the board, your upbringing, right? Your age can change your smell, right? So when you're a baby, remember the baby smell when you smell a baby? So different. And then as you get into the older years and get into the pre-pubertal years and the pubertal years, you're going to find that your smells do change with time because of the hormone changes, right? So just know that the changes of the smell all over the body does occur as you age. But let's hone in on the vaginal smell and the male genital smell, or the penis smell of the penis, or the scrotum stuff, right? I want you to first of all understand that there are different types of smells, right? And remember, if you want some studies, I do have some studies, okay? Just let me know. Let's talk about the smells in terms of men and women. Okay. All right. So, musky smell. Okay. That musky smell is where you sweat, right? And sweat is clean. Your sweat is clean. It's only when it mixes with bacteria on the skin that it starts to get a smell, an odor. Okay. So, if you have an odor in the vaginal area from sweating, let's say you went to exercise or you're working hard at work and you're sweating, it's the bacteria there that makes that smell. So if the bacteria there is bacteria that's really smelly, you're going to have a smelly area down there. And if it's clean bacteria, meaning more good bacteria versus bad bacteria, it'll smell less, right? Again, is there some genetics there? Is there some physiology there? Yes. When you are exercising and sweating and you're exuding that clean sweat, it's the bacteria. So the bacteria comes from within. We have millions of bacteria in us, right? And viruses and fungus, put them all together, right? And they're supposed to be our friends. We've got to be friends with them because they are living with us all the time. Everywhere you go, they follow us and they're within us from our top to the bottom, right? So we want to make sure they're good bacteria. And that's the probiotics. That's where probiotics come in, right? But you have to be aware that if the area down there is funky, musky, it's because the sweat there has been tainted with bad bacteria. So, how do you get rid of bad bacteria, right? Well, it's not that easy sometimes because it does involve a few things that we have to do. We'll talk about that in a minute or two down the road. But if we can get you to understand that that musky smell can be good if there's not bad bacteria there, but it can be bad if there's bad bacteria there. So again, depending on how intense it is, depending on how strong it is, some people will be turned on and some people will be turned off, right? So if you have that shower and you walk out of the shower and then you get that smell, there's something telling you that bad bacteria is more than it should be, right? So we've got to look into that. That's the musky smell, okay? For men and women. Women, we have to know that we get a musky smell too. We've got to be careful. That hair traps a lot of bad bacteria. So you've got to be careful in terms of whether you want to trim that hair or not, which is again an individual thing, but you want to make sure it's clean. To make sure it's clean, of course, it's your showers and keeping the area free of bad bacteria, okay? Which is hard to do, but again, we'll talk about it later on. A lot of it is genetics, a lot of it is how you take care of yourself in terms of hygiene, but a lot of it too is innate, meaning the bacteria are there whether we like it or not, environmentally, okay? Metallic. There is metallic smell that women get after menstruation, okay? So whenever you smell blood, there's that metallic smell. It's the weirdest smell. I'm sure you've all, well, adults have smelled it, right? That smell down there can be after menstruation, right? In women, right? It also can be in men, right? If they're doing something in terms of, maybe some rough sex and there's some blood, they can have that smell too. So it's a very unique smell. Think of it after blood, after menstruation, okay? Then there's the fishy smell. Remember the fishy smell? Everyone knows the fishy smell. Now, the fishy smell I get a lot of, right? They come to me all the time, Dr. Kathy, I've got this fishy smell. What do I do? And the first thing you want to do is first of all find out whether it's an innocent fishy smell or not. Okay, so in women, we can get bacterial vaginosis, and bacterial vaginosis is because of the shape of the vagina. It is an easy way to trap bacteria, and once that BV, bacterial vaginosis, once that bacteria grows, you're going to get that fishy smell. So it's really, really noticeable when it's powerful and it's a lot. Because you can get a little bit of fishy smell, which is a little bit natural if you have a little bit of the BV, right? But if it's overpowering, you can walk into a bathroom and walk out, and someone that's been in there, you can smell that smell, and it's not right. It's overpowering. So you've got to be aware of that smell and get that taken care of, okay? And a quick tip for that is lemon water or vinegar. I tell people all the time, lemon water, no sugar, vinegar, just for a week, just a glass a day, put it with water a week, and just know that that is a natural way of refreshing and getting rid of bad bacteria, especially the BV, okay? And yeast sometimes too. So if you have that fishy smell, you want to find out whether it is bacterial vaginosis. And again, you can get antibiotics for that, see your doctor for that. You're always going to see a doctor, by the way, you guys, when you have these smells that are overpowering. But you're going to try the lemon water and the apple cider vinegar, or the just regular vinegar in some water, and that should help it. Okay, but you want to check and see whether you have bacterial vaginosis, right? Because that is something that might be hiding some other things in there too. So you want to get checked if it's a discharge that is coming out with women, right? With guys, balanitis, which is an infection of the glans penis, the skin around there, right? You want to make sure that there's no infection there, which can occur in men, and you get that fishy smell. Um, Sometimes trichomonas will do that, give that fishy smell too. So be careful, get checked. If that's a powerful smell that doesn't go away, I'll give it a few days. It doesn't go away, get checked by a doctor, okay? Then you have the yeast. The yeast is something that women get a lot. We get that cottage cheese sort of white discharge. Some people say it has a smell. I personally don't notice a smell, but some people say it has a bready smell, like bread, yeast, and even a beer smell. So when you smell that beer with men, you can get that a lot with the guys. That beer smell, you start wondering, okay, is that yeast? But if there's no like white film or jock itch, it's probably not yeast, because with the guys, they're shaped on the outside, so they don't get that BV like we get, women get, and they don't get a lot of candida either, because they're airing, right? That penile shape is outside, so it has a lot of air that will circulate and keep the yeast away. So a lot of that is probably just jock itch, which is on the skin, okay, and that can be treated again. Is if you go over the counter, there are things over the counter, and you can actually speak to your primary care doctor if it's not going away. Because remember, I've had some patients that it's there for a long time. Something else is going on. Your immune system could be at risk, and you could also have diabetes. Diabetes is something that's very common, where you'll see a lot of yeast in both men and women. So please, please, please be careful with that. Okay. You can also get that sweet smell, right? There's a sweet smell you can get with diabetes, and if you get that fruity sweet smell when you're down there and you notice it, either partner notices it, please get your sugar checked. It could be high blood sugar, it could be diabetes. You have to get that blood sugar checked, and go to your doctor and get that checked, because that sweet smell is normally a sugar issue. Okay. You can also get a very strong urine because of that sugar, okay? Because that sugar makes it very concentrated, okay? Apart from that sweet smell, you can also get a foul, awful, terrible smell. And that in women usually is a tampon that's been left in there, y'all. So if you got that foul smell that is horrible, the worst smell you can think of, like something's dead inside there, right? I've seen it quite a few times. You want to make sure you didn't leave a tampon in there. Or it could be an STD, a bad STD. So please always get checked for STDs, all right? That's from the beginning. STDs is number one to be checked for. I always say get checked. Even if you're not sure, just go get checked, because it can hurt those tubes, ladies. It can stop you having babies. So you really want to make sure you get those tubes checked, okay? And get the STD check, because your tubes can be blocked from any of these STDs. Well, not any, a lot of these STDs. I won't go into that right now. But you really want to have that knowledge. Any discharged women, I go gaga with my girls, my ladies. Get that checked. My guys too. But you guys are hiding a lot of this stuff now. Back in the day, you had it on your underwear. Now you guys are hiding things. So please know with STDs, get checked, because they're hiding from both men and women down there. Okay. Yeah, more in women, but now in guys too. Okay. So that's the foul smell. Just try and make sure that you are not having a foul smell. That is an immediate attention to the doctors, immediate trip to the doctors, okay? You can get a urine smell down there too. That urine smell is something that women will get if they're leaking, right? If you get that woman that has a weak bladder and she's not able to hold her urine. Guys too, you have that weak bladder, you might not be able to hold your urine, and that's from the prostate affecting your urine. So you'll find that you dribble and your underwear gets wet easily and you're not emptying, you guys. So you want to make sure that that is taken care of. And addressed so that we don't have that smell down there for both men and women. Both of you can take care of it, right? Getting those pelvic floor exercises for the women, getting checked by your GYN, Uro-GYN, and you guys getting your prostate checked by the urologist. Please, that could be an issue as to why you're smelling urine down there all the time. I mean, if it's once in a blue moon, fine. But if it's constant, get checked. There might be something leaking there in terms of the weakness of the pelvic floor, okay? Stools, we can get stools there. And by the way, with the urine, if you're not having a good shower too, you can get that urine smell. So how often should you shower in a day? Some people don't shower at all. I know that the showering is a big issue medically because they're now saying we shouldn't even use soap down there and clean because they're taking away the good bacteria. You don't want to overdo it. You don't want to take away the you don't want to take away the good bacteria and the bad bacteria by overdoing with too many abrasive things like alcohol or vinegar. Please don't do that. Don't do that. You're taking away the good bacteria and you're going to cause a problem for infections and your immune system later on down the road. So please don't do that. You're going to not be able to fight off infections when you need to fight it off, okay? But that shower is very important. So same thing with, the fecal smell. If you have that stool smell, there are a few things that might be going on there. The first thing you want to be sure about is that you're having a proper shower and that you're cleaning back there and you're drying back there, right? Yeast can get there if you don't dry there, right? Yeast is very, very easy to grow in a moist place and it will really give you that sense of itching and stuff like that. So please, please, please get that checked. But you want to dry that area and have a shower at least once a day. Okay, at least once a day. Now, if you're in a temperate, cold area, you might not want to. So, every other day, fine. But personally, once a day is good. And nothing abrasive. Like I said, a gentle, natural soap. Okay, I love natural soaps, meaning doesn't have a lot of synthetic chemicals and things that should not be in your body wash. I think some people say that whatever you put on your skin, you should be able to eat. Not the same thing for washing, of course, but you want to get one that is as natural as can be, okay? Just for the safety of toxins in the soaps. Just be careful with that. Feces, all right? So the feces can get there, and that can also be coming from a weak, anal sphincter, right? So there are certain activities, anal sex, that will make that area very weak. And so you want to make sure that you don't overstretch the anal area if you are doing anal sex. And that's for the homosexuals and for the heterosexuals. You want to make sure that you are, some people use a plug, but some people will make sure that they exercise and make sure that it comes back to the normal size. Because sometimes if you don't, it'll stay big and cause fecal incontinence. So that is something that you want to see your doctor for sure for, right? A colorectal surgeon or go to your GI specialist. They'll check you out too. Your primary care doctor can check you out also. Hemorrhoids can do that. Hemorrhoids can make you have some stools, right, in your underwear, guys and girls. So please get that checked out. Very easy fix, right? You can fix hemorrhoids very easily. If they're small, the bigger, the more difficult. But please get that checked because again, that will make that area down there, funky, right? We don't want that feces smell. So you want to make sure it's clean and you want to make sure it doesn't keep on building up. Medications can do this too, right? So be careful with that. So those are some of the smells that you'll get down there in the, genital area that you can address. And you have to know that people don't like some of these smells, right? Especially the feces and the urine, right? You want to make sure you have that shower. You want to make sure you address the cause of it, right? But sometimes you can't help it. So you go to your doctor and get that taken care of, especially if it's persistent, right? It gets that strong smell. Any of those smells become very powerful. It doesn't go away after a few days. There's burning, there's redness, there's itching, there's a vaginal discharge or a penile discharge. You must get that checked. Okay? Very important. And I'm going to say, urgent care, ER, just go get it checked, y'all. Because again, it can cause a lot of problems for you later on in terms of your fertility, especially for the women, okay? Guys, you can get into trouble too. It goes into that prostate, stays up in that prostate, and the next thing you know, you're having a burning semen, all right? And women will complain that the semen going into them is burning also, again, because that's because you didn't take care of those infections, early on, and they're hiding in the prostate, okay? So I know that happens. It's rare, but it happens. So if it happens to you, please, guys, big hint, get a semen culture. It's just a big hint, just in case that smell doesn't go away. Get a semen culture from your doctor, okay? So some of the reasons, again, why we have these smells, I mentioned the different smells, your diet, right? Asparagus can do it. Fish can do it, right? Meat, a lot of meat can give you that foul, bad bacteria smell, especially in the stools, right? And in your urine and your vaginal discharge, you'll smell a lot of that. But I must say that I've had some patients say that they have no smell. They don't eat meat. When they're vegetarians, they have very clean diet. They don't have a smell. And they said, Dr. Kathy, how can I get a smell? So I said, eat some fish. Now, I know if you're a vegetarian, you don't want to do that. So if you don't want to do that, you're going to find out that you are not going to have a smell. And again, some guys want a smell. Again, I've had them complaining, Dr. Kathy, why doesn't my girlfriend have a smell? I'm like, bring her to me. Let me talk to her. But again, some guys don't want a smell. And when the guy says they want a blueberry smell or they want you to spray perfumes, please do not listen to them. That is wrong. It's chemicals, dangerous. They could have cancer-forming ingredients in there. Please do not spray anything down on your genitals, men and women. Stay away from there, all right? It's bad enough we use deodorants with aluminum stuff in it too. Fine, I know. But you have to, and you do not use it down there, please. You do not want to cause any problems of cancer, anything down the road. Remember the talk on the baby powder from Johnson & Johnson, they all in that lawsuit. So please don't put anything down there. Keep it nice and clean. Like I said, the medical community is now saying that just water, no soap. I know that's tough, but try and make sure that your diet is healthy, right? Not too much sugar. Like I said, not too much sweet, because you're going to get that sugary sweet smell down there, which can be a little bit concerning if it's diabetes, right? If it's persistent. You also want to consider your hygiene, how you shower. Like I said before, you want to shower at least once a day. You don't want to overdo it. Some people say they shower 3-4 times a day. I'm like, you're taking away the good bacteria. So don't overdo it. You really want to make sure that you have a balance on your skin, okay? Like when you use too much of the hand sanitizer, be careful, because it can actually take away the good bacteria there too. So don't overdo it, all right? Wash your hands. They say, 15, 20 seconds, wash your hands and make sure you have clean hands. Don't overdo it. Nothing too abrasive, nothing like bleach. Please stay away from bleach, y'all. That's too bad for the skin and dangerous for the skin, okay? Again, no douching, women, just in case you're douching. Absolutely no douching. We cannot douche. I know you want to douche after your cycle. I know you want to douche anytime you might have sex, but sex can actually cause some irritation and allow BV to flourish in the vagina. So remember, you can get that taken care of by getting some apple cider vinegar or vinegar and lemon water, no sugar in the lemon water, and making sure that you are checked if it doesn't go away, right? Medications can do this. Medications can give you these smells, depending, like antibiotics can do that, depending on the medications. Vitamins will do that. Everyone knows if you take vitamins, you can smell it in your urine a lot of the times, right? You take a lot of vitamins. So be careful with your medications. And, if it's something that you want to address, always see your doctor and talk to your doctor about it, okay? What else can cause it, right? So a lot of times when you have a smell, again, it is natural. It is something that you can't really change. But again, if you're wearing loose clothing, sometimes that will help air it, right? Allow the area, especially down there, to get a lot of nice oxygen to keep the bad bacteria away, because bad bacteria don't like oxygen, right? And fungus, they don't like oxygen, and keep it dry, like I mentioned. What else? Diet, I mentioned. What else can affect it? Some people say when you are sick, right, it will affect that particular area. And sometimes it's because you get either dehydrated or you're not eating. And so you get this ketone-like smell down there. Like ketones are from when you're not eating, it's almost like you're fasting, you break down these sugars and you form ketones. And so you really want to make sure that if you're not well, you keep yourself clean also down there, so it doesn't change the bacteria that are down there, okay? And I think that's about it. So the question in terms of, do we have a smell that is good or do we have a smell that is bad, really is going to depend on a number of factors. If it's persistent and it stays there forever, please get checked. But if it's there briefly and it goes away, or if it's something that you know you have and you're concerned about, please get it checked by your doctor also. But I would like to say that it is normal to have a smell, not overpowering, right? It is normal to have a little bit of a fishy smell for some women. Um, Again, like I said, depending on the situation. But there are pheromones there that attract the men, right? Like in dogs, right? You see those dogs go crazy, right? We also do that for our men. And I think the men too, we have that attraction to them, like I said earlier on in my discussion with you, where we actually get sometimes an immune system attraction unknowingly to us. So just remember the smell, if it's overpowering, yeah, I understand. But if it's not, it's natural. Do not spray crazy things down there. Guys, please don't encourage that. It is dangerous for your women. And we want your women to live forever and ever. Okay? So we don't want all those crazy things that could happen from it. And you guys also, don't be so, picky about your, being too clean too. Don't overdo with the showers, because I know some women and some men do that too. And again, it can be dangerous for you in terms of the normal flora on your skin. All right. Hope you learned something today. I will be with you guys, I guess, tomorrow. And we'll see what we're going to talk about. Because I'm going to soon go into techniques. I want to talk about certain techniques in the bedroom. But we'll talk about a few more topics before I get to that. I want to plan for that, okay? And I'm also planning to do a talk, questions, ask questions, call in, and see how we go with that. So I'm working on that right now. But thanks for listening, and I will see y'all tomorrow. Okay? Take care. Bye.